Hi, my name's Juan, and this is DuxCan. What's DuxCan about? Uh, in essence, I've created this channel so that I can help educate the masses as it pertains to healthcare operations, explain how things work, why they work the way they work, upcoming trends, upcoming changes, regulatory, both from Fed and federal stands, or possibly local, regional stuff. Uh, there's always change in healthcare, and just when you think you got it, it changes on you. Now the focus is it's multifaceted. It's for consumers of healthcare, which we all are, and it's also for the folks who work within healthcare that don't understand why things are done a certain way, possibly, or from an operations perspective on understanding what does the revenue cycle management side look like, or how a practitioner, provider of some sort, how they overall impact the larger group. So focused, but it can get a little broad. But all relevant to healthcare because that's my field. Part of the reason that I'm interested in doing this and just putting myself out there so vulnerably like this is because I want to help the next generation of healthcare leaders. Basically, once upon a time, I had no experience 15 some odd years ago, and it was quite revealing when my leaders didn't understand half of the things that went on, and if they didn't understand, then they couldn't explain it to me, and so I'd like to facilitate that, facilitate explaining things a little bit more so that we can have more meaningful conversations as an industry. Um, Probably one of the more shocking things that I found through the years was that oftentimes it's at the very top, CEOs or directors or various chiefs, they don't necessarily have a good understanding of what the fundamentals look like in terms of running these healthcare organizations. And that was quite a shocker because just, you would assume that if someone is in such a high role, that they would know what the heck's going on, but not necessarily the case. Or simple, anything simple. If you've got enough exposure and if you've you've dedicated time to understanding, there's nothing very difficult about operations, but healthcare operations, but uh, you have to put in the time. So some of the more interesting, simple questions in my mind that I've had is like, how do I keep my providers busy? How do I set pay rates or pay ranges? What's the difference? Why are they important? Um, or how do I know when to hire more staff? It seems like a straightforward question, but the answers are very complicated in that you have to understand a variety of moving pieces in order to make a decision like that, or else you run the risk of wasting a lot of money, a lot of time, and actually hurting the organization. Um, get into all those things all in due time. So, what qualifies me to talk about these subjects? I've spent over the past 15 years. I've spent specifically in healthcare organizations. Most of my experience has been in mental health, inpatient hospitals or outpatient multi-specialty psychiatric type clinics, addiction medicine, child and adolescent and adult, running varying groups of psychotherapists, launching service lines like Transcranial Magnetic Stimulation or TMS, and being able to help all those various types of organizations improve on process or launch new products or whatnot. That's me. I love that stuff. I've also been involved in directing family practices, primary care groups, cardiology groups, a variety of things in that nature. I've held a lot of different positions over the years in management and leadership. Been chief strategy officer for a large mental health center. But to me, my crowning achievement is actually in 2018, I helped my wife, who is a psychiatric nurse practitioner, set up her own private group. And in Colorado, the name of the group is Bright Futures Psychiatry, and it is running smooth and strong. And very, I had to put all my skills to work there in helping her get started. So, needless to say, I've been around the block. I know quite a few things, and I think it's important for those of us who do know to share, because we have to help each other out. If we don't help each other out and grow from and learn from one another, then we're missing a really big part of what we can do with our lives to impact others. One last thing about why it's important. Why now? Post-COVID, here we are at the end of 2022. This will obviously going to date the video very soon. But in 2021, the U.S. spent over $4.3 trillion in healthcare. $4.3 trillion, and that's roughly 20% of the GDP. 20% of the GDP is a massive number. 4.3 trillion is a massive number. Most countries don't make that kind of revenue as a whole, and we spent it in healthcare. Deloitte, the massive accounting firm, is anticipating the number that's spent on healthcare to increase from 4.3 trillion annually to 11.8 trillion by 2040. 2040, that's not that far from now, 18 years or so, and it's going to get to $11.8 trillion, which is, I did some calculating, and it looks like even if we just stayed at the 20% mark of GDP, it would make it to where the U.S. has to produce near $60 trillion a year in order to meet that $11.8 trillion demand for healthcare. Those numbers are almost, they're not really real for most of us. It's just how many commas is a trillion? And so it amazes me why more of these conversations aren't actually taking place. It's getting to a point where we're spending more on healthcare in this country than other countries make total. Actually, probably much higher than probably the next two biggest countries in terms of their GDPs, and I'll come back with some hard numbers for you all very soon. So anyhow, I appreciate you watching this intro video. I've got lots of cool stuff that I'm going to bring to the table here very soon. I would recommend hitting the subscribe button so that you don't miss any new posts. Really cool stuff coming. So thank you so much for your time. Much appreciated.